Do you know that within 12 years, rural America will be facing a staggering 66% shortage of geriatrician, endangering the healthcare of millions of seniors? Good afternoon. My name is Diomara Valle. I am a nurse practitioner and an advocate for equal access to care in rural America. I am here today to address a handful misconception that has quietly impacted millions. The belief that nurse practitioners need physician supervision in order to provide safe, quality care. This inaccurate notion not only underestimates the capability of nurse practitioners, but it also endangers the health and well-being of countless Americans, especially those in rural areas who lack access to qualified healthcare providers. You, nursing students, future APRNs, and upcoming leaders must advocate to ensure healthcare policies that guarantee full practice authority for nurse practitioners across all states in our country. This is crucial to effectively combat the ongoing healthcare provider shortage in rural areas. As of July 2023, 46 million Americans live in rural areas. About 20% of that population are adults age 65 or older, and this share is continuously increasing. By 2030, it's projected that 1 in every 5 Americans will be 65 years or older. And compared to the urban counterpart, the rural adults have an 11% higher rate of hypertension, a 40% higher rates for diabetes and cardiovascular disease, a 30% higher rate for stroke, placing it a greater need for continual primary care and the need for geriatrician care as well. According to the CDC, 1 in 5 adults in rural America are already lacking regular healthcare providers. The National Center for Healthcare Workforce projects an urgent and alarming mismatch between the supply for primary care providers and the rapidly ongoing demand for them in rural areas. As you can see in the table, there is only going to be 34% adequacy for geriatrician care, 42% of adequate staffing for internists, leaving a staggering 42% of patients in rural areas without having adequate primary care providers. This staggering disparity demands immediate attention and action to ensure that rural communities receive the essential healthcare they deserve. A community without a healthcare provider is like a town without a school. People will leave. The shortage of healthcare providers is forcing families to relocate. It's disrupting the lives of older adults who wish to age in place within their community, not only depriving them from the social and emotional support that they need, but it also is strengthening the fabrics of our communities by breaking them apart. The scope of practice for nurse practitioners in the United States varies from state to state, resulting in significant variations in the roles and responsibilities across the country. An APRN study from 2024 exemplified the impact that states' SOPs have on access to care. The story was about a small town, Glen Olin, in North Dakota, with just 700 residents. Over 1/3 of those residents were adults aged older than 65, with a nurse practitioner, Rhonda, being the sole healthcare provider for the community and for the town's seniors. Without her, they will be forced to relocate just to get basic care. Providers like Rhonda can effectively keep our seniors safe and well cared for within their communities, because North Dakota is one of the 27 states that provides full practice authority to nurse practitioners, empower them to fill out the essential roles in underserved rural communities, and address the healthcare provider shortage by ensuring better access and quality of care to the aging population. Unfortunately, in 12 states, nurse practitioners continue to have reduced practice authority, requiring collaboration with physicians, and in 11 states, nurse practitioners have restrict practice authority, mandating NPs to work directly under physician supervision. We train NPs to be leaders, but the states ties their hand with restrictions in their SOPs. Without physician availability to meet the state supervision requirements, there won't be enough nurse practitioners to help close the provider shortage gap. Furthermore, the state regulations for supervision and collaboration forces NPs to enter into collaborative agreement that requires them to pay physicians thousands of dollars yearly for this supervision, just to meet the state's requirement. This additional financial burden makes APRN less likely to practice in states with reduced or restricted scope of practice, exacerbating the needs for providers on those areas. A full practice authority is like unlocking a second gate on a packed stadium. Suddenly, people can get in safely and quickly. Full practice authority saves lives. States with full practice authority experience better patient outcomes, better patient access, and a strong nurse practitioner retention. Rural full practice states have higher rate of nurse practitioner to patient ratios, which enables timely and continuous quality of care, reducing waiting time. Preventive care visit and chronic management are more prevalent in full practice states, leading to fewer emergency department, fewer hospitalization, better management of comorbidity, and better patient's outcome. Easing scope of practice has also been associated with a reduction in healthcare-related deaths by 12 per every 100,000 patients. Additionally, nurse practitioners in full practice authority states report a 92% job satisfaction. They report the lowest intention to leave their job, just like around 20%, making them most likely to practice in these rural areas. Rural American communities are facing a provider shortage crisis. It is not going to get any better. Legal barriers are keeping NPs from being able to help. Full practice authority works is safe, provides quality of care, and it saves lives. I once believed policy has nothing to do with clinical care. I know now that silence is compliancy. Staying quiet is letting patients suffer. You can be the voice that drives change if you choose to advocate. You need to understand your state practice environment. You need to get involved. Join organizations. Join nurse practitioners coalitions and advocacy panel. Share your story. Share your patient stories. Bring it to the legislature table. Imagine a future where rural community has accessible, reliable care, where seniors age in their community, where clinics remain open and they're staffed by MPs just like you. When we fight for full practice advocacy, we're not just empowering MPs. We're safeguarding one of our most vulnerable populations. Be the voice of change. Let's work together. Let's advocate together to improve healthcare equality in rural America. Thank you.